Hi guys, we are live. I'm Dr. Ellen Marmur, Menopause DERM, sharing my journey with menopause, not only from skin, but everything that you need to know. And this is Dr. Georgia Witkin, a wonderful friend of mine and the smartest woman alive. I'm gonna give you a quick intro here.
That was a paid political announcement.
I'm turning off the music. She's assistant professor of psychiatry at the Mount Sinai School of Medicine and also assistant professor of the OBGYN department, where she's the director of psychology and wellness at RMA of New York, which is a fertility clinic and center. She is a best-selling author of 13 books on stress. She also just sold 5 movies, which she didn't want you to know, but I'm telling you. She directs patient services and development at Progeny and writes Chronicles of Fertility for Psychology Today magazine. And she has a headlining article right now called Debunking Stereotypes About Menopause, and that's what we want to talk about. So it says, don't let menopause misconceptions scare you away from embracing midlife. So I just recently did a series with my husband, who's a cardiologist, and a great friend, Lin Chen, Dr. Chen, who's OBGYN. And one of the stories we talked about was the effect of stress on our bodies and our wellness. I think I got 3 critical comments about maligning women by saying that we're just stressed out, almost like we're hysterical. So I sort of wanted to talk about, why is it bad to say that we go through stress? Is it a bad word to say, I'm stressed? Or is it a real medical problem? Or how do you handle that?
Great question, because my books are not only on stress, they're books on women and stress, because everyone was writing about their men, the heart attacks, their type A's. So I started researching this a long time ago. Here's the deal. Basically, we're built for stress. Humans, for millions of years, have been stressed. We had bears chasing us, we had to migrate, all kinds of things were happening. So what happens under stress is that our body's ready for fight and flight, but not for 4 years of it, not for COVID and for children having problems and elections and, economy changing. So I'll condense all 13 books into one sentence so you can save all the money. When your sense of control goes down, stress goes up. So the problem with stress is that it activates any of your weak links because you're using up your adrenaline, you're using up your serotonin, which is your happiness hormone, your hormones that are governing reproduction and, your menstrual cycle are saying, I better take the back seat because right now I've got to save this person. Obviously, there's an emergency. Do women experience more stress than men? Absolutely not. Are we hysterical? Absolutely not. In fact, what I found is we handle stress very well. We're built for daily life. But here's where we have a problem. We tend to relive and pre-live and worry and watch and wait because our brain is built to anticipate and take care of everybody. And unless we keep bringing ourselves into the present and we keep doing some things to burn up the adrenaline and we take pauses, we do wear ourselves out. But we do not create infertility. Infertility creates stress, not vice versa. Good egg meets a good sperm, you can get pregnant during wartime. We do not give ourselves cancer. That's blaming the victim. That hurts me when people say that, It's your own fault, or you should have relaxed, or if you meditate every day, you're not going to get sick. Some of it's what you're born with, some of it's what you're lucky enough to not come in contact with, but we're not killing ourselves with stress. We're just making our daily life a little more difficult because we tend to lose our perspective. We're taking care of everybody else.
It's really easy to lose perspective at any point in our lives. I think in our 20s, our 30s, our 40s, we're like,
Absolutely.
oh my God. So actually I had a young woman just yesterday who's 26 years old and she's so pale. And I was like, you know what, let me just run some blood tests on you. I thought she was gonna have iron deficiency anemia, but it turns out her DHEA hormone was very low, off the charts low. And I didn't really remember what that hormone was, but I looked it up and it's an adrenal hormone, right? And so if you have chronic stress, it can actually exhaust your
Exhaust, that's the
glands.
right word.
And it's true, it's the true word. It's like a metric. It's not just like, oh, I'm tired. It's like literally use up, like you said, some of the hormones in your body. So you actually do have, there is a little yin and yang about it too. Like stress can cause actual hormonal problems, or you have to see an so I sent her to an endocrinologist to see if she has a pituitary problem or has adrenal problems. But so you said the word wait, and you meant wait, W-A-I-T, like waiting for things to happen, and the worry and all that. So how does stress change your W-E-I-G-H-T? How does it change your weight, your body weight?
First of all, more than anything else, women say boredom changes their weight.
Okay.
Someone was coming out of COVID, like, I was a little bored, so I cooked, I baked, I ate, and so forth. In order to make serotonin, which is the happiness hormone, as it goes low, the body needs carbs. Did you know that?
No.
Yeah. So if you're feeling down, you crave carbs, you crave sugar. Also, there are a lot of chemicals in food. Food is all chemicals. Even an orange is all chemicals.
Right.
And some of the chemicals are stimulants. So take chocolate. Tastes sweet. And if your life is not very sweet, so that's good. It's a carb. Helps you make temporarily a little more serotonin. But then when you look in the mirror, you use up more serotonin, and then you need more carbs or crave the carbs.
Okay, so then your weight can go up.
Yeah.
I know. So some people ask, like, in menopause, what's the amount of weight that women gain? On average, in the American Heart Association statement of 2019, they said really you can only attribute 5 to 7 pounds of weight gain to menopause. So those people who might be 15 pounds overweight by that point may have other things going on, like you said, and may want to just focus on some of the very boring things like exercise, good sleep, eating a little less chips like I like.
Right, that's why people feel a little better. It is also said that as you get older, it is better to be normal weight than thin.
Yeah.
Remember, you were never too thin was the motto?
Definitely.
Not true anymore. Too thin is just as bad as too heavy.
100%. And why is that? What are the medical reasons for that?
You don't, my mother, who went through 5 cancers, beat them all, died in her late 80s of a heart attack. You knew my mother. Mastectomy in the 30s, hysterectomy in the 40s, mastectomy in the 50s, stomach cancer, thyroid cancer, etc. So I went into menopause in my 30s because I had my ovaries out prophylactically.
Surgical menopause.
Yeah, after one child. So that's why I'm interested in menopause. But she used to say, because she had hips, and people would say, well, don't you want a lipo? She said, are you kidding? Every time I got sick, I lived on that fat.
That's your vein. That's what it is. Yes.
Right. So I think that that's
Love
part of
fat.
it. Yeah.
And fat is estrogen. Fat is a hormone.
That's right. That the body is trying to make up for something, and your cravings is making up. But if you can find better ways of getting what you need.
Yeah. If anyone has any questions, please ask. Our team will try to answer some of those questions. So let's go back to surgical menopause. Okay. And some of the debates at the time when you were going through surgical menopause, hormone replacement therapy might have been given a bad rap. So how did you navigate your journey so early on with surgical menopause, which just means that you were thrust into menopause sooner than maybe you would naturally have gone?
Maybe like 20 years sooner. So I learned a lot from my mother. And one of the things I learned is to look at change as something new, not a loss. Okay, so this is different. I didn't lose anything. And I remember maybe a week after I had the ovaries out, and therefore I no longer had PMS, I no longer had migraine headaches, I no longer had weight gain. I was no longer screaming at everybody in the house for 4 days. I said, oh my God, is this the way men feel all month long? This is pretty wonderful. So I saw it as a change that was positive, not at a loss. Yeah. When it came to hormone replacement, you would think with all my mother's cancers and my grandmother's cancer, everybody in the family had cancer, that they would say, oh no, don't take estrogen replacement. At the time, and there was a researcher, Dr. who's still, I think she's still practicing and had her mother on hormone replacement all her life. She used to say, we don't know how women are after menopause because women used to be dead by then. We're all living so long. Our body probably needs estrogen. And my breast cancer specialist said to me, your percentage of increase of risk if you take estrase cream, not orally, but just locally, will go up maybe by 2 or 3%, but your quality of life will go up 100%, because I was already getting cystitis, I was getting dry eye, I was getting dry skin. And so you have to make your own decisions, you have to speak to your own doctor, please, I'm not prescribing. I'm just saying for me, the quality of life was very, very important. And I am now still using vaginal estrase cream. Not a lot, not a full tube, but I really, since I'm 108, I found it really
52.
You're right.
So that brings up I think the core of this whole new conversation of like, for women who are at risk for breast cancer or who have had breast cancer, are they disqualified from any type of estrogen replacement? So can you go back to that and tell us?
I can't speak to that because that's not my specialty. My personal experience is that when I'm dealing with patients who have prematurely lost their menses because of cancer and surgery, the majority are still being put on a low level of replacement estrogen. But you have to have your blood tested because the adrenals are still producing some of your cycle. And I know people who have had surgical menopause and are still going through a minor cycle.
Wow.
Yeah. And obviously it's not from the ovaries.
We're all so fascinated. So I think that goes into why everybody's personal journey matters so much. I remember in medical school, some of the lecturers, often men, would be like, oh, it's an old wives' tale that A, B, or C. And I would get kind of like harumphed because old wives' tales are commonly like the community's journey of medical problems that they observe. So we call that empirical, like observational science, is looking at how people handle certain things. And so many old wives' tales actually became modern medicine.
Interesting.
And so I think that when we talk about our personal journeys, it is helpful to the next person, which could help the next person, which could help the next person.
I like that.
Until we have precision science. So stand by, or we're gonna, I guess, wrap up the live, but we're gonna go through a speed round of the 5 things you can do to make the most out of menopause with Dr. Georgia Witkin.